Hi everyone, my name is Hannah. Today we will be performing sterile trach suctioning. So first there's some things that you need to do before you even get sterile. So I'm going to walk you through that, and I'm going to be kind of acting like I'm talking directly to you as the learner, but of course you would do patient identification, you'd be explaining everything to your patient. So first, I would raise the bed. I'm tall, but most people need to raise it at least a little bit. Then I would really recommend you drop this railing entirely and that you remove the pillow. The reason why I recommend you remove the pillow is because, of course, she's not a real human being. She's a little bit stiff. So I find her neck is too crunched to be able to kind of suction her without removing that pillow. It's just a lot easier for you. And then the way that you're normally going to find the suction is probably hanging on the wall like that. So before you begin, you're going to want to take it off. Make sure it's working. And you want to get it in a really good spot so it's not going to fall like it just did. So that looks good. We're going to want to make sure we have an ambu bag available. Don't worry if in your comp we don't have you do the ambu bag. You can just verbalize it. Sometimes we're comping so many people at once that we don't have them available, or just to save time, we have you verbalize. So we can go over that with you before you begin your comp. She has the trach mask here. So you'd want to look over too and make sure it's on however many liters of oxygen that it's ordered at. I'm going to turn that off though because it's pretty loud, just so you can hear me. Okay, so we have all that done. Now we're going to come over, hand hygiene. We'd say that we had cleaned the table before we began this procedure. We are going to open up away from ourselves. If that happens, all you do is just do it again. And I like to get rid of this. I have a trash there to have some space for working. Then before you completely open this, there's one other thing you have to remember to do before you get sterile, and that's take out this little box, put it together. The inside is sterile, so you don't want to be contaminating that, touching it. You're going to take your solution and dump it in without touching the plastic bag part. And notice how I'm doing this away from the gloves and the packaging, so I'm not reaching over that sterile field, because that is a sterile field. So I'm going to kind of move that out of the way. All right, so now we're at the stage where I can open my packaging and apply my sterile gloves. All right, and you can adjust everything once they're on. They're on. And again, I'm not at the hospital today, so I'm wearing my rings. Don't be a bad nurse like me and take your rings off for this. Okay, we got this. I just want to talk about this a little bit. So this is the packaging that the suction tubing comes in. Some people choose to attach it to the suction tubing like this. Some people choose to take it out. I like to pick it up. I get rid of this. I coil this up in my hand. Because right now I'm all sterile, right? So I get how I want to be. Purposely going to contaminate my left hand. Connect. So now my left hand, or whichever hand is your dirty, contaminated hand, should never ever touch the catheter. Okay, so it should only apply suction. It applies suction when you press down on it. We apply continuous suctioning only when we remove the catheter. So first I'm going to check that it's working. Okay. I like to coil it back up so that when I'm carrying it over, I have less risk of contamination. Now I'm going to warn them that we're going to do suctioning. I'm going to move the trach mask to the side. I'm going to grab my ambu bag. Again, keep an eye on where your catheter is. You want to always kind of be able to see it. Connect. A couple breaths every 6 seconds. Just do like 2 breaths just to show us that you know that you need to hyperoxygenate the patient. Now we're going to get ready. So I'm going to uncoil. Keep this catheter, suction catheter up is my recommendation. So when you go in, you're not applying suctioning. Going in, keep your fingertips away as well from the trach. That's a common mistake of contamination. And then when you're ready to come out, you feel resistance, they're coughing. As you're coming out, kind of grab it and suction the whole way and pull up. Okay? And then you're gonna Be careful. Make sure you put the trach mask back on. And coil it if you want. Clear the line. All right. I'm ready to go. If you did not have the ambu bag, I'll do an example. You just say, I would hyperoxygenate the 2 breaths with the ambu bag and monitor their saturations, their oxygen saturations the whole time. And again, going in. No suction as we're going in. They're coughing. Suction continuously on the way out. Keeping it up. Okay, a common mistake is that people will be going in and not paying attention to where the suction catheter is and it's touching the chest. So be careful of that. Be careful it's not touching your body, your own chest. Those are some common mistakes. And then again, of course, when you're going in, this finger kind of touching the trach. So if you notice any of those, please state it, self-identify, say I just contaminated my sterile procedure, and I would start over from the beginning. So as you're practicing, just make sure you're self-identifying any breaks in sterility. That's it.